Something disturbing I've been noticing in the last 3 weeks since my son took his life is that most of the cases I've been hearing about have been of kids like my son who were happy, healthy, showed no signs or warnings. And myself, like many others, I keep asking, well, how do you know to look for something, or how would you have even tried to help, um, especially if there wasn't a failed attempt or something that would have warned you. And the realization I'm coming to now is that the majority of the kids these days are that way. When I was growing up, when you had someone that was troubled or was having issues, it was typically outward, and you could normally tell because they were either dressing differently, maybe in goth or darker, they were starting to have piercings, or they were getting a tattoo, listening to sad music, because they were acting it out a little bit more. And this younger generation of ours is so, as I've been saying for years now, unable to articulate feelings, unable to communicate. They're so used to their devices and be electronic and stuck inside their technology that they don't know how to express what they want to express. So they have an internal battle of whatever their emotions and battles and demons are. So that's why I think we're not noticing. If you think about it, as parents, maybe we just want to hear they're happy and healthy and normal. But if you think about it, should a 12 to 17, 18-year-old be normal? Should they not? Would you think they should come up with something, right? That if there's peer pressure, um, dealing with issues with their body changing, that, like my son, every time I would ask him, everything was fine, his friends are fine, his feelings were fine. And maybe that's just what I wanted to hear. I should have pried a little bit deeper, because if you think about it, a 12 to 18-year-old shouldn't be normal. So I think you have to set a baseline. Watch for your child's small indications. Digging deeper into my son's behavior, and I'm starting to find little things that maybe should have been red flags. So set a baseline. And what kids are doing these days is they're acting happy because they don't know any other way to express themselves, but they're doing it internally. So if you see a behavioral change, even small, don't sign it off as, oh, my child is growing up, they're going through hormones, must be stress at school, there must be like little things, it's normal, they'll sleep it off. Any little indication is an indication. I wish I would have went with my gut. At that time, I didn't even have a gut feeling. Now I'm looking and seeing there were issues. So look for small things in your child because they may be acting normal. And I think normal and happy and healthy may be the sign, because they should be having some kind of struggles and they should be coming to you with something. So keep an eye on your children, especially the happy, healthy, happy ones, because normally none of us are always that way. But as adults, we express our emotion. When we're unhappy, we come home. And when I come home, my wife can tell right away if there's something on my mind, because my behavior is different. But with kids, they come home and put on a happy smile, and they keep all their thoughts and whatever they're thinking inside, and that turns toxic. So all I can say is watch out for the small signs. If your child is happy, healthy, normal, maybe that's a sign in itself that you should dig a little bit deeper. See what they're searching, check their internet history, check their search patterns, see what videos they're watching, because the face they're putting on to you could be a totally different face than what they're feeling on the inside. And I'm learning that that is certainly a big sign to be looking for. I hope that helps.